Morning. Let's start our panel. I'd like to start by thanking Chausier and the team of FIS Initiative for having invited me to be here. And we are going to talk about how to ensure sustainability of system through access to innovation. We have here two dear friends. It's great to see them in this difficult 1 year and a half that we've all had. And because of that, we haven't been interacting so frequently in meetings and events that we were normally together. We have Guilherme Hummel, who has a postgrad in information system, over 21 years experience in digital health, and he is head and mentor of eHealth Mentor Institute. And he's the author of many books on the topic. We also have Hans Fernando. He is a researcher in health, a manager in population health. He has experience in public health and private health. To present, he is the head of the medical area of the health tech Vitta. We're going to have here a conversation on the topic. I'd like to briefly introduce some generic points about that, and then I'm going to give you 10 or 14 minutes to each of our guest speakers. And finally, we are going to have the questions sent from the participants. Let me start by addressing sustainability of the health system thanks to access to innovation. I think it's a very relevant topic. And in my understanding, I would rephrase it as saying ensuring health sustainability through access to data, information, and knowledge. Innovation would be the enabler of this continuous this continuum that would be required for us to have a sustainable system. Healthcare generates a lot of knowledge all the time. We can no longer really keep up with the changes, and all these new creations using existing technology and future technologies are going to help us make decisions in the system. Our health system is fully fragmented. And I would like also to hear from them about how innovation can help us integrate the system. How can we really help have a better integrated system? So these are some of my initial remarks. I think that innovation is still fragmented, sometimes simply meeting the specific interests of all the stakeholders of healthcare. And our challenge is how can we bring together all these innovations and translating them into a better experience of health users, leading to enhanced quality of life and also increasing their life expectancy. There are many challenges in healthcare systems today, and there are a number of tools that can be quite helpful. I would like to ask Guilherme to go first to share his thoughts with us, and then Hans And finally, we can talk and interact about what we hear from them. Thank you, Guilherme. Thank you, Hans, for your time and availability. And I'm sure we are going to learn a lot from you this morning. Thank you. Thank you, Marcus. It's great to be here with you and Hans. Thank you, FIS, for the invitation. Very great content. Kudos to you, Josie. Well, in 10, 15 minutes, we won't be able to solve the problems of healthcare in our session. At least we can discuss and come up with food for thought. And I'm going to start about addressing time, so that these innovations, which are outside from healthcare chain, can come into the market. My whole life, I studied in a kind of school based on the thoughts of the Christian thinkers. And I hated St. Augustine and all of that. I really hated it. When I was writing my second book, I had to think about time and I had to go back to St. Augustine and understand it back, because he was one of the main thinkers about time in society. Things were very simple to him. The only existing time is present. Past is only in our mind when we bring it to it. And the future, likewise, is just a mental projection, whatever you call it. But none of them exist. If we are here and we just recall a moment we were together, we are going to remember it right now. The next moment, it has all become past. So the past doesn't exist. And this is why he talks about present of the past, present of the future, and present of the present. To St. Augustine, only the present exists. I'm going to quote Silvio Mira to think about present and future. And he uses a very important expression. He says, the future comes from the future. Our cognitive sense thinks about past, present, and future, but because of the speed of transformation, as Marco pointed out, as a result of this cyclorhythm, the difference of the century, and because of the pandemic, the future is no longer coming from the present or the past. It's coming from the future, really. And I could give you an example from telemedicine. We worked 10 or 15 years that we really wanted to have telemedicine. And suddenly the pandemic came, and 4 months later, the whole healthcare chain was either using or providing telemedicine services. So a transformation happened outside healthcare chain that end up transforming it. I'm going to use some tools from his. There's no cloud, no video. And if I don't explain with that, okay, I won't be able to explain it anyway. According to St. Augustine, this is a coaster. And let's try to understand it as being our present. We are all here, including the three of us. And this is where I can put all the healthcare chain, all companies and public systems. So our cognitive sense says that present and future gets out of the present. It becomes future, but it emerges from present. And Silvio says, no, it's not quite so. The future comes from the future. It crosses the boundaries and get to you. And there are many examples that we can see in healthcare market that can be explained through that. Marcus, who was a health economist, He's constantly talking about medical regulation, transformation, physicians' compensation. So what happens? It's here in the present to be prospected in the future, but it hasn't happened yet for many reasons. However, what happened? Open banking, open finance, open insurance, a number of things which were not part of our journey and got to our present. And they are bringing a number of factors into healthcare. The same with electronic health records. We used to believe that it would be something, an axiom to the system, and we translated that by planning and implementing and bringing the tool to the future. What happened? It didn't come. Now we have metadata, we have virtual reality, and a number of other technologies to some extent really consider the importance of the medical record. And I think that this is the only solution to avoid fragmentation in health. But ultimately, all of us are daily bombarded by a number of exogenous factors outside our market, company, health, that end up interfering in healthcare and transform it. So what is the suggestion that I would like to make to think about innovation? It doesn't matter if it's a health tech, incumbent, or a city department. The energy of the company is here at present being allocated to solve the problems of the company. We have to make the company get to the next day. And all these problems are problems from the past, not of the future, because we don't know which of them will come to us. Some are here, transforming, but most of them we don't understand yet. Recently, I took part in a MIT Sloan Management, the following information. 80% of all opportunities, of all disruptive innovations that exist in the industry of service are here in the crown outside the frontiers of the company. You see, it's as if the future came here, future got here, the other one here, and some of them get very close, and they get even before we absorb the shock. So to make sure we can have better access and more innovation into healthcare, considering primary private health, because it's a greater problem than public health, in my opinion. So I think all companies in the industry should bring together teams, people, and entity within their frontiers, investigating 24/7 to identify the nano opportunities around it. They are nano opportunities. They are, let's say, satellite of opportunities that gravitate around companies. Telemedicine, when it was getting here, there were dozen hospitals in Sao Paulo which were prepared for telemedicine. They were using telemedicine. They already had a level of investigation to know what the frontiers, the borders could absorb. When the future just arrived at the door, they were prepared for it. So health techs can do it. Most of the transforming power and competence are just used to investigate the borders. Incumbents stay here, spending energy just to making sure that the company can get to the next day. And health techs, such as fintechs, have it in the economic area. It's a comfortable position, so to speak, where they can investigate the future. So I think we should include it's no use saying, well, the CIO, the executive director is paying attention. I'm not talking about that. I'm talking about digital pathogens, people who are there on the borders of the company in real time, identifying all these small and minor transformations that are hitting, and they are going to transform the market. And I would like to quote Drucker, the good old Peter Drucker. In the 80s, before he passed away, he wrote a brilliant book. Innovation is transformation, behavior transformation within the chain done by suppliers or consumers. Nothing to do with technology, even though technology can be an accelerator. So innovation is what? Behavior transformation. And going back to the example of telemedicine today has no difference from what we used to have 10 years ago. But what has changed? The behavior of the players in accepting the new idea, both consumers and suppliers. So the innovation that just invaded abruptly our market in this 20 months of the pandemic was a behavioral change and not a technology change. I see no new technology, no artificial intelligence, machine learning, nothing. What has changed is the behavioral and cultural understanding of the chain of accepting and getting connected on the borders to understand what's going on. The borders are here, interacting with the market, with competitors. So here, closer or apart, so they can see the same borders that we can, and also with consumers. Investigating the transformations that consumers are willing to embrace. And to close, just an example. 10 years ago, in 3 years ago in 2019, almost all HMOs and hospitals, they wanted to have, and they had it as a mission to improve the service provided to patients. It's like a mantra. I really need to help the patient get cured. I have to offer treatment procedures. 20 months later, we have been through huge transformations in terms of self-care. And everyone realizes self-care differently from what we used to believe 20 months ago. So what is on the border? And we have to understand, companies have to understand, what am I going to do now to support self-care of consumers who are much more focused on it than they used to 20 months ago? These elements are the facilitators, the enablers for us to improve healthcare system, primarily the private care. And I think that if private care, it just moves on and on a little bit, 47 million users, and it's been so for 10 years. It has to be perceived. Am I really paying attention to what's going on with the market? Was I really understanding what was happening with the low-income medical clinics? Has the company realized that I would like to have someone come to my home and collect my labs? Transformations, they capture stakeholders from healthcare and prevent stakeholders from thinking about innovation. And then I get here at FIS, I see so many sessions, everybody agree, but the actions do not happen. They still do not happen. We are here just talking. And going back to St. Augustine, and this is why eHealth Act is important in our times, because all the concept of conditions to make a transformation all our power of transformation and the conditions that the company have to transform are really strong, especially of incumbents, but not of great interest. And health tech, conversely, it cannot maybe make transformations and really subvert the system. However, they are interested in doing it. And this is why they are always one step ahead of the main players in the market historically, and I'm sure that's not going to be different now. Now, Marcus, thank you very much.
Thank you, Guilherme. You've brought several interesting points, generating a reflection and the last point, there is always a question. Why this world in fast transformation finds in practice on the day-to-day in a system that faces huge difficulties? The implementation of what is already available. Of course, many things have arrived, but as you stressed in your this sort of outer figure, this difficulty of penetration, in fact, of this innovation to provide some kind of gain or care as a whole. In the private, we can observe that, but transformation and the impact of it, the whole, and we have to remember the term of sustainability in its full sense. We are still to see that. I have another question, but I'm going to hand over to Hans. Thank again. Well, you have your 10, 12 minutes of presentation, then we'll go back to a chat based on the topic that we are discussing. Well, now, good afternoon, everyone. It is to be with you, to meet you. It's a great honor. Thank you very much. Thank you, Josier, and all the FIS organization for the invitation to be here. It's always very good, and we always have great learnings. Guilherme, I believe that the three of us, have never sat down to that. But your speech is wonderful. Before you ended, I wanted to congratulate you. And you see that it's not rhetoric. Actually, it is, well, because I would say that all the concepts that you bring here, I can actually live in my health tech life. So it is quite impressive to see the depth and quality of your analysis, how realistic it is. And the sort of the edge image is quite wonderful. I actually, after you said, I think I should change a bit the direction of my talk. So we have been talking a lot about from health techs, and we have been making some correct actions more than wrong actions. So let me add to what you've said. The first thing, the St. Augustine, the future, present, and past, wonderful reference to bring it up. And actually, the edge closing with the MI Well, this has been the learning very much on the concepts that you put. It is in the sense of our having what we have on the edge with the well, since it's a technology company, what makes me alert is that when we have that innovation, what is the opportunity? What is the concept? Actually, how can it actually, as in very concept, in very sound concept, yet it is a counter sense for you to use sound concepts, but it's a safe path for you to expand your edge from time to time. What do I mean by that? We, for example, our gateway is primary care, is that if organized, we've understood in the running of the history. In the practical sense, the technical opportunities that we can enjoy in the practical sense, they should impact significantly, for example, in the attributes, fundamental attributes. What is the impact it has on access in this longitudinal feature? What impact it brings to integrality of the service, for example? If we can observe that certain things will have significant impact in such fundamental aspects like primary care and other examples we can give to other levels of care, very likely they will they will bring a benefit to the business, to patients overall. I say very likely because you've also addressed this thing, and this is one of the aspects for you to which ensures that the individual is in a border, that you can observe them minimally a trend in your change of behavior. If you don't minimally have a change in behavior, probably it's not so in the border as you would imagine. Perhaps technologically, perhaps from the standpoint of the logic of your business itself, but when you get to people, that is the fundamental stage. Again, the cycle can be so long that may not be feasible. So, to seek this border, strengthening concept where we can step clearly and confidently, perhaps is the fastest and safest way for us to innovate. This is what I have seen. This is the experience I have been accumulating the past 3 months. And I think a lot about a conversation I had. Some people know about it, but some years ago, I had a conversation with a great CEO of a large organization, US organization, with great experience. He had just given a dense talk towards encouraging his organization towards organization. Let's be bold and innovate. It was very strong. And after his talk, I got in touch with him and I had the opportunity of interacting with him for 30 minutes. And the question I wanted to ask him was how he differentiated courage from craziness or madness. So, well, if you have to take risk, well, people may think that it's sort of jumping out of the window. And he has this sort of habit of sort of going over his hair and said, funny, I'm looking at my organization and I've been looking into that for, 4, 5, 6 months. And nobody has ever asked me this question. But I hope it hasn't been bad. It's a good provocation, but I'm going to answer you. My answer everything. So whatever has a volume, something a river, when it's a big, wow, well, great river, river to great challenge to be crossed. Well, you have the challenge of that. The crazy will just jump there, will start swimming desperately to get to the other bank and deliver the task that has been given. The brave guy will take some time, will look and try to map where is there a stone, a branch, so which place they have to swim, and they will at least map it out to identify your border, Guilherme. Ultimately, this is what we're talking about here. And even make a test or, on the bank or the border. Let micro community, some beneficiaries, and actually can run a better test to see if it works precisely. So I think to be brave at this time is to innovate, strengthening the concept, especially in complementary health. So we still have a huge challenge for the most concept. So for the strengthening of the concept, if you can get a point that Marcus has brought that has been fundamental, no longer have an isolated solution to resolve a problem. When you build an integrated solution for all the activities, for all the events that make up the frequency of events in a given health system, then it seems that you're moving towards something that actually, well, this is my expectation, bringing something, in my opinion, living that you can actually bring a reality that is a bit different and a step forward, considering what we have today. Obviously, it's very difficult for you to start with everything integrated, having a health system, considering all its broadness and have everything integrated. It won't be possible. So we have to have this path moving from people, have information around people. And as we encompass in terms of variety, all these primary care actions, coordination of care, specialized visits, procedures, etc., hospitalization, until you have a minimally integrated ecosystem. It doesn't have to be. Sometimes we want more than we actually need. So, you have a clinical record that's necessary. So you need to have good, structured information of what's happened in that hospitalization. That's a great leap compared to what we have today. It's another border. So this is the expectation today that we have. And that's a project like this that we have been developing, that we've had the opportunity to participate. And I'm going to get the recording of our conversation here and benefit the opening remarks of Marcos and Guilherme's remarks so that we can share there with such brilliant concept by both of you. I'm going to stop here, otherwise we won't have time for our chat. Once again, my super thanks to be here with you, and thank you very much for all the learnings. Thank you very much, Hans. You brought interesting points, complementing and even adding to what Guilherme mentioned within that model on the border. From the beginning, and after listening to you, I took some notes, and I'm going to make some provocations with now no specific order. Feel free to comment on them. Perhaps I kind of took note of 4 or 5 points for us to debate a bit before we get questions from our colleagues in the audience. The first of them, of Guilherme's talk, added by Hans's talk, reminded me of a class I attended in an MBA of business strategic management 25 years ago, kind of, in Sao Paulo. After actually moving into economics, it was perhaps an MBA that introduced me a bit in the life of business. And I've learned a lot. And I remember one of the lessons, it was a session with professionals from different companies here in Brazil, and each one of them contributed in a spectacular way, bringing or sharing their experiences in one of the classes. And I remember it was at this time a bit over 25 years ago. He brought up the following challenge to all the students. We were 25 in the classroom. He said, I'd like you to think about something about the future, some technology, something that will happen that you believe that does not exist today, and some time for debate. And then the students debated, and each one had to present an idea of future. What was the take home from the class? Very funny that everything that had been said, this professor was a great scholar and studied a lot of innovations at the time and the incorporation of everything, very much tuned in to what was happening. It was finding that everything that was being said about the future somehow already existed at the time of our conversation. So this is very much connected to what Guilherme said, the aspect of present today, things that we do today, looking into the future. It's very much tied to what we have experienced, to what we experience in the future. Of course, we don't have experience of certain things. The access to information allows us to imagine. And this imaginary of ours, at that time at least, would not go very far. Do you believe that this is still valid today? And why perhaps this difficulty of our looking into this future? Do you think we are not looking into our present so well and the problems that we have today? So this is a question that I'd like to bring up. And I ask a second question, perhaps Hans can share with us, and perhaps Guilherme would address that a bit. In Guilherme's speech, he mentioned that he sees perhaps the aspect of innovation as a greater problem in the complementary system, from what I understood, than the problems of our public system. If we consider that we have this single health system and we have two parts and we move about both of them and the difficulties of sustainability of the system, the public, not only because it is bigger and much more present in our territory as a whole, why this impression of being a greater problem to the complementary system? Because the system perhaps has conditions, at least theoretically, of innovating more than the public system. Because in my view, they may have heads that make decisions much more easily and readily with conditions than the very public system with its own difficulties. So I'd like to address these two topics with you to start with and see what you think about this. As to your first question, I have great difficulty, Marcus, of looking into the short-term future. To be frank, I'm not interested in what's happening in 2-3 years. I don't live and don't dwell there. Political, social conditions, even technological conditions, they are dated. Any technology, any new technology that goes into the process has an entrance and exit date. This is a finding. My world is always a world of thinking about mid and long term. Actually, I think our great problem in the national health system, public or private, is because we always think in the short term. We always want to resolve the problems that are emerging. And there is nobody on the outside to think about what's happening way into the future. So since complementary health, so what has been happening? There's a huge concentration, few players in the market, and they sort of let go and lean back in this situation and do not have an investigative policy to change complementary health. People say, well, regulation, legislation, it's all silly stuff, nonsense to me. Well, as it's changed in telemedicine by osmosis, you have to change. When you have a demand that is much greater, there is much more pressure on the chain. Automatically, players in the industry make the change to happen. The feeling I have in complementary health to me is that where they are is okay for them. So they have sort of leaned back in the situation where they are. They don't let go of the space and they try to somehow provide a kind of demanding agenda, but when they have to have a specific change to clean the whole chain, they do not commit to that. Saint Augustine even said, you're only loyal to the past. Nobody's loyal to the present or the future. The future, you don't know what's coming. You cannot be loyal to something you don't know. And the present, anything that you are loyal to, second later, it became past. So the managers of the private health chain, they have high loyalty to the past, great difficulty to see the future. That's why I trust health techs that have a greater visibility of these borders to make the necessary adjustments. I believe the change in SUS, the public system, will come from a signature. A new guy will take office as it happened to Sérgio. Sérgio Mello, the Minister of Communications, he was a crazy guy. He was there, then privatized everything, and he just didn't care. And that's what's going to happen to public health. So we will have mandatory measures. As in the case of the electronic health record, how's it coming? With a signature, with a pen. You force people don't get the SUS will not get it as it happened in the US, the UK, Medicare from a year or so. As it's, in 3-4 years' time, it will be mandatory to have this protocol. So from the standpoint of public health, I think it has much more difficulty to innovate than the public sector. The public sector only depends on one factor, which is resources. If you change the administration and you have resources, funds, it changes. Nothing at Data SUS. People are there that they don't know what we're talking about here. They do, but they don't have the resources, financial resources. Hans, up to you. Just something that I'd like to add. We have 5 minutes to conclude. We don't have any questions from the audience, so we'll continue presenting our standpoints. Sure. I have the impression that, again, the great advantage of the public system, of part of the public system, are the fundamentals. They're much more solid. And once you have financial resources, it's much easier to innovate with a solid foundation than in a scenario where you have a lot of things to adjust. So it's very difficult to build a second floor if you don't have the ground floor. So we need the ground floor, solid, firm, to build the first floor. So it will come with the pressure of new players. And I think we would need a signature for the public health system saying, well, this is the system we have, whatever it is, be it public, private, everybody has to follow the rules. From now on, that's it. Like the banking industry, one day the central bank decided, for years they gave all the map to the Federation of Banks. They ignored it. They moved ahead. And one day the central bank said, this is the future now. That's going to be like that. So I'm liberal, but there's no way, fans. If you don't decide on put it from top down, things won't happen. Things will happen by need or despair, but it will happen. So, we have to act upon ourselves. And so I think it's interesting to think about that, because I don't know if it's just the organizations, but the people, why change? I'm just fine today, I'm okay here. So, so actually, this is the path each one chooses and the direction people can give and have to give. And we are actually discussing alternatives for this contribution to happen in a more significant way. And I believe that the perception of people commenting what they have, what they see, it's a bit of the border. It's what we can see. This role is key to those looking far. I worked very much in technology, looking or having this role to look beyond the border. And a lot of things will happen when, you see beyond the border. It's like a Formula One car. If you think there won't be any innovations in 5 years' time, that innovation in Formula One that was incredible is in our SUV cars, So it's important it's very important to have the cutting edge. But the life of the masses happens on the borders or close to the borders, and that's where we have to move towards, be it in complementary health system or public health systems. That's where we have to move towards. So we have a great responsibility. Conditions are incredible. We've never had these conditions ever before. We know what to do. All of us working in health have to challenge ourselves to deliver something better than what we've been delivering in the past years, I believe. Thank you, Hans. We have still more minutes. I'd like to make a provocation quickly. I have 3 questions that still make me feel very restless. And if you can answer quickly, the first would be, Guilherme brought up the importance of transformation, behavioral transformation in the incorporation process and usability even of those new innovations. What is the size of this challenge? Joe, well, throwing the ball onto you. Sorry. Let me ask the 3, and then you can think about that in the meantime, so we can be brief and be able to answer them. The second, now we're talking about the sustainability plan. If I take this leg of sustainability with this bias and its economic importance, when do you think, in terms of the health system, reflecting in efficiency gains in the very health system? This is a question about time, because the system is anguished, is pressured. It has opportunities for that. And the third is, how do you see today as a strategy, attempt to incorporate because we already have innovations, favoring, so to speak, to complement the operation of healthcare professionals rather than replacing their operations. That connects to the first question I asked, which was the fear of the incorporation itself threatening possibly stakeholders in the healthcare system. This is applicable to people as well as companies. Just briefly, very quickly, the 2 first are connected. When we talk about change in professionals, they need those changes. So when we have a cultural change, everybody has to take part. It's just, we have 2 minutes because we have to close. I just got this information. I'm going to leave some questions open, but Hans, conclude, and then I'll ask Guilherme to say his final remarks. I apologize, but we have a time limit. So cultural changes, well, for professionals, fundamental. For me, the Brazilian complementary system, there's a person that needs to change. So representative of the client, the HR manager of companies, this individual still has to understand and challenge him herself regarding health. They hire people, and theoretically they are the most interested party and are very important, these people. Guilherme, you're on mute. Your answer, Hans, is very broad change in HR to me. I'm going to use it in my conceptual rationale on the doctors, Marcus. I believe doctors will be replaced by machines. No, I do not. But will doctors be replaced by the doctors that use the machines? The doctors that cannot manage the machine will disappear. Actually, I believe that in this century, doctors will be transformed much more into an educator than a healer. Their task of educating patients will be much more relevant than their function as a healer. Thank you very much, Guilherme. Great conclusion from Hans and Guilherme to the points that have been brought up. I would like to end this panel talking about sustainability and incorporation and innovation in healthcare with the challenges we face today is actually a topic that is very vast, difficult for us to manage within such short period of time. Now we have certain reflections and food for thought. And before I close, I once again like to thank Josie FIS to take part of this event that is quite fulfilling and quite fruitful. And of course, we will have a lot to think about in addition to the short period of time we had at the panel and contribute to the maturing and improvement of our health system. Thank you all very much. And thank you, FIS, for the opportunity.